apexogenesis versus apexification versus revascularization. Many a times, almost every year, students they ask me this thing कि difference क्या है, एंड तक I don't think कि students को clear होता है. थोड़ा सा tricky है, बस major कोई नहीं है. So consider, so there is a 8-year-old boy, central incisor, history of trauma, pulp expose. So trauma, pulp exposure is there. Now, what is the thing? The thing is that the pulp is still there, that the vital pulp is still there. So the patient reports to us immediately, means within 24 to 48 hours. Within 24 to 48 hours, patient comes to us. So either trauma, this one, or you were preparing a cavity, mechanical or iatrogenic perforation, open apex case is there. So in that case, what we are going to do is, so there is a pulp which get exposed over here. Okay. So what we are going to do is, generally we do a pulpotomy, and then followed by that we go with the apexogenesis. Pulpotomy and apexogenesis. Pulpotomy means partial removal of the pulp. So we can either remove partially the pulp like this. Okay. So this is called as partial pulpotomy. So this is called as partial pulpotomy. After the scientist named Sweck, so this is also known as Sweck's pulpotomy. This is a repeated MCQ. So pulpotomy and apexogenesis, these are generally combined things. So when we are doing pulpotomy, majority of times the reason is that the apex is open. You want to close that thing. You want it to close naturally. So pulpotomy, we remove this part of the pulp which is infected and we retain this portion of the pulp. So vital radicular pulp is important for apexogenesis. Apexogenesis means which is naturally occurring phenomenon. Naturally आपका root close होगा, so that is the apexogenesis. But remember, for apexogenesis to happen, this natural phenomenon to happen, vital radicular pulp is the most important part. If pulpal necrosis is there, if there is no vital pulp in the root, radicular pulp, then you cannot go with the pulpotomy and apexogenesis. So 8-year-old boy comes to you within 24 to 48 hours, you can go with the partial pulpotomy. Okay, partial pulpotomy has got a very good prognosis. If he comes to you say after 72 hours, then probably you will require a full pulpotomy. So full pulpotomy means remove pulp up till the orifice. Full pulpotomy. Okay, so pulpotomy is already a partial removal of the pulp, but partial pulpotomy means only the infected superficial pulp you will remove. Full pulpotomy means you will remove it up till the orifice, retaining the radicular vital. So apexogenesis, I hope it is clear. Naturally root apex will close because it is a normal phenomenon. So root will get thickened, so root wall will thicken and the root length will also. So eventually what we will have this picture. So eventually what we will be having is this picture, canal which is there, and above this probably we have done an MTA. Above this we have done MTA, which we have done almost say 2 years back, but see, now important thing is see, the root is closed. So important thing is, see, apex is closed. So in case if we require a root canal, apex is closed over here. See the thickness of the dentinal walls. So the root walls are thick, and the improved crown root ratio. Crown is to root ratio is improved. So these are the advantage what we get in apexogenesis. Now apexification. So apexification is again open apex case. But instead of, after the trauma, instead of patient reports to you within 24 to 48 hours, he comes to you say after 1 week. Now what happens, that the pulp is dead. So there is no pulp over here, or necrotic pulp over here. Now what you can do in this case? How to do a root canal treatment in this case, because now there is no chance that you can do a apexogenesis over here or a pulpotomy over here. Pulp to is not there, na? Pulp is necrotic now, to completely necrosed pulp. Can you save this tooth? We have saved many such teeth by using the procedure which is called as apexification. So in apexification, what we are doing is, that we are creating an artificial barrier over here. An artificial barrier over here is formed by placing a calcium hydroxide for long period of time. So what we were conventionally doing was, we were placing calcium hydroxide for prolonged period, say around 6 months, 12 months. What this will do, this will lead to a formation of a calcific barrier over here. Now since now the barrier has formed, so what you can do is, you can fill this thing with the gutta percha. So you can now fill this canal with the gutta percha and the sealer. Previously, which we cannot do since the apex was wide open. So apexification is artificially we are forming the apex. So over here, remember the important points is that the pulp is necrotic. Necrotic pulp is there. Open apex is there. Necrotic pulp is there. And we have to do an obturation. So we artificially create a barrier. Artificial barrier is created over here. But look at the problem in apexification. So the problem is, see, apex was closed over here in apexogenesis naturally. Over here apex is closed artificially, means you have tried to close the apex. Okay, so there is a barrier which has formed, but you have tried to create it. Now that barrier is majority of time is not a complete barrier which forms. So apex का वो natural closure thing is not there. Now root walls thickening. So it is absent over here. But look over here in this scenario, from this thickness which was minimal, this thickness which was minimal, okay, this is the thickness. So eventually what you will get is that the canals will shrink in size and you will get a thick root wall, root walls will be thickened. So that is very important, because otherwise you will lead to cervical fracture, it will lead to. Now this thing is absent over here in apexification, and the crown root ratio will remain poor. See, the crown root ratio will remain poor. Actually, what we are doing in apexification is that we are freezing it at this moment. Okay, so this picture was there and this picture will remain. If this tooth survives, if this tooth is going to survive, say for 5 years, 7 years, then this picture will be there. So what is the problem? See, the problem is, one thing is that the apex which has formed is incomplete apex with calcium hydroxide apexification, definitely. Then the root wall, these root canal walls, these are not thickened, they are weak, they are friable, they are prone to fracture. Cervical fracture will happen over here. Then poor crown root ratio is there. Poor crown root ratio is there. Now comes to what is a revascularization thing. So look, important thing is over here is that MT apexification or calcium hydroxide apexification is good if the scenario is like this. If the scenario is like this, scenario is like this means the root walls are long, central incisor. So the root walls are good, the length is good, crown root ratio is good, and the root walls are also good in thickness. But there is an open apex. So in this case, and the pulp is dead, pulp is necrotic. So in this case, apexification is a good process. Whether calcium hydroxide is an orthodox one. So nowadays we do MT apexification. We will discuss it also. So MT apexification will be very good over here. But MT apexification in this scenario, okay, in this scenario will not be good. Why? Poor crown root ratio, fragile walls are there. So these two will lead to failure. Now the same patient comes to us. Same patient comes to us after 7 days of pulpal exposure. So pulpal exposure was here also, pulpal exposure is here also. Okay. So after 7 days of pulp exposure, again the patient comes to us. Now again you need to understand over here that the pulp will be necrotic pulp. Necrotic pulp is dead. Okay. And by doing apexification, we will freeze the tooth at this moment. Means the picture will remain the same. The root will not grow in length. The root will not grow in thickness. So we know that ultimately this tooth will be doomed, bound to failure. Now if by somehow this tooth which is necrotic pulp, okay, so the pulp is not there. So if we can do the same thing like what happens in apexogenesis, but in the absence of the vital radicular pulp, that is called as revascularization. So over here necrotic pulp is there, so everything will happen same as apexogenesis, but only difference is that this will happen in the absence of original pulp. This will happen in the absence of original pulp, because the original pulp is dead, necrosed. So what we are doing in revascularization is that we are creating a pulp like tissue. We will discuss revascularization in detail, in the traumatic injuries and avulsion chapter, but over here I am just comparing them. So we are creating a pulp like tissue. So that pulp like tissue now, which has formed with the help of the stem cells and all, which will create, now that pulp like tissue will start forming a dentine like tissue, or cementum like tissue, and due to which we will have the picture of same thing. So eventually we will be having the tooth, which is like this, with the canal which is like this. So how we get this thing? In revascularization? Because over here, though the pulp was necrotic, but with the help of some cells which are over here, stem cells, what we do? We create a pulp like tissue over here, which will come into this pulp space, and now we will have a functional pulp like tissue. Now that functional pulp like tissue, what it will do is that it will start forming the root part. Okay, so root wall will get thickened also, and root wall will get elongated also. So we will have all the advantages of the apexogenesis. So see the advantages: apex will be closed, you will have root walls which are thick, and you will have a better crown root ratio. Otherwise, if we would have resorted to apexification, then the poor crown root ratio will be there and poor root wall thickness will be there. So remember, in these two pictures, the patient comes to us with the same scenario, necrotic pulp. Okay, so it is up to us whether we want to go for the revascularization or apexification. Now in apexification also we can go with the calcium hydroxide apexification, or we can go with the MT apexification. MT apexification, definitely it is nowadays used. We are not following the calcium hydroxide apexification. For apexogenesis to happen, remember the most important thing is that the vital radicular pulp. The pulp should be vital. Then only we can go with the apexogenesis thing. Otherwise, if the pulp is non-vital or necrotic, then apexification or revascularization only we can go. Okay, and in that case, remember always revascularization will be having an upper hand. Okay, revascularization. So if we compare, revascularization will always be have an upper end or upper hand over apexification any day. Any MCQ, remember revascularization. If we can go for revascularization, it will be a better answer. But the best one would have been apexogenesis. Apexogenesis will be the best. But remember the important thing, if all these three comes in MCQ, you need to see whether they are saying that the pulp is vital or non-vital. They might not directly say you that the pulp is vital. Okay, so they might give you that 24 hours to trauma. Okay, so 24 hours to trauma means pulp is vital. So if the pulp is vital, best apexogenesis. Okay, pulp is vital, important thing है apexogenesis के लिए. Pulp is non-vital. Okay, pulp is non-vital, we cannot go with the apexogenesis. Necrotic pulp, we cannot go with the apexogenesis, because remember, pulpotomy is done for the apexogenesis, natural apex formation. Then we will have to go with the revascularization. Revascularization is why it is better, because we will get a almost similar to what happens in apexogenesis. We will get the complete root formation, the root length will be good, the root wall thickness will be good, and we will have a functional pulp-like tissue. Artificial, though we have created it, it was not a natural one. Apexification will be the last resort. Okay, but in apexification also, remember, empty apexification is better than the calcium hydroxide apexification, and empty apexification is very good. Majority of the clinical scenarios, like the clinical scenario what I have told you, like this case clinical scenario, empty apexification will give you a very good result. Okay, so I hope that the basic things about the what is a pulpotomy and apexogenesis, what is apexification, and what is a revascularization comparison is clear to you people.
The first step towards achieving your dreams is having the right coach. Get the best education with BDS to MDS and make your NEET, MDS and INICET dreams come true. Download the app now.